What if the very pill protecting your heart is quietly sending distress signals that you are completely misreading? If you or a loved one are among the millions of older adults in the United States taking Amlodipine, Losartan, or Lisinopril for high blood pressure, you need to open your medicine cabinet and look at those bottles very carefully. There is a silent, pervasive danger in senior healthcare today, and it doesn't stem from the medications being inherently bad or toxic. Instead, it hides in a gap of critical communication. Most medical appointments are far too short, explanations are rushed, and patients frequently leave the pharmacy with a bottle in their hand, but only half the information they actually need to stay safe.
To understand how easily these gaps happen, you only have to look at Gloria's story. Gloria was 72 years old, fiercely independent and remarkably disciplined, the exact kind of patient every primary care physician hopes to have. When she was diagnosed with hypertension, she didn't complain. She took her daily blood pressure medication exactly as prescribed, never skipped a single dose, and kept every follow-up appointment. On paper, her treatment was a massive triumph. Her daily numbers improved beautifully, dropping right into the ideal target zone. Her chart looked perfect. But a clinical chart rarely tells the whole story of a human body moving through a real house. 3 months after starting her routine, Gloria was sitting in an examination room, visibly shaken, telling her doctor that her shoes no longer fit. Every evening, her ankles looked strangely puffy, and her legs felt heavy and exhausted by bedtime. She was terrified that she was rapidly gaining weight, while her daughter worried that these swollen limbs were a sign of absolute congestive heart failure. What nobody had taken the time to explain to Gloria was a simple biological truth. These 3 incredibly common blood pressure medications are not interchangeable generic pills wearing different labels. They are entirely separate classes of drugs that manipulate your internal environment through completely different pathways. Because they work differently, they create entirely distinct patterns of side effects. Amlodipine relaxes blood vessels mechanically, which frequently causes fluid to pool in the lower legs. Lisinopril acts on a hormonal pathway that can trigger a chronic, dry tickle in the throat. Losartan blocks specific receptors and demands close attention to your kidney filtration numbers. When you do not understand the specific pattern of the pill sitting in your morning organizer, you begin to misread what your own body is trying to tell you. You assume all blood pressure medications behave the same way. You shrug off a persistent night cough as seasonal allergies, panic over swollen ankles thinking your heart is failing, or miss a silent chemical imbalance building quietly in your bloodstream. Your side effects are not a personal weakness, nor are they something you must silently endure just to keep a number looking pretty on a monitor. They are data. To protect your health, your longevity, and your independence, you must step out of the fog of half-knowledge. Your safety relies entirely on learning the warning signs, tracking the patterns, and understanding exactly what that little pill is doing inside your body. If you or a loved one opens your morning pill organizer and finds amlodipine, you are looking at one of the most widely prescribed blood pressure medications in the United States. Belonging to a class of drugs known as calcium channel blockers, amlodipine does a magnificent job of lowering your numbers on paper. It works by preventing calcium from entering the muscle cells of your heart and blood vessel walls, forcing your tightly constricted high-pressure arteries to relax and widen.
But while this mechanism is an incredible triumph for preventing strokes and heart attacks, it comes with a physical side effect that catches millions of seniors completely off guard: swollen, puffy ankles and lower legs. In the medical world, this fluid retention is known as peripheral edema, and it is arguably one of the most misunderstood side effects in senior healthcare. When an older adult notices that their socks are leaving deep, painful indentations by 5 p.m., or that their favorite leather loafers suddenly feel suffocatingly tight, their minds instantly race to the worst-case scenarios. They assume their kidneys are suddenly failing, or they live in absolute terror that their heart is giving out and they are sliding into congestive heart failure.
However, the truth about amlodipine-induced swelling is entirely structural and mechanical. To understand why this happens, imagine a complex plumbing system. Amlodipine relaxes and opens up the tiny, microscopic arteries that bring fresh blood down into your lower legs and feet. It does this beautifully. However, it does not dilate the veins, the return pipes, at that same rapid, generous rate. Because the entry pipes are wide open, but the exit pipes remain the same size, a hydraulic imbalance is created. Blood flows down into your lower extremities with total ease, but it struggles to climb back up against gravity. As the hours tick by throughout the day, pressure builds inside those tiny capillary vessels in your feet and ankles. To relieve this pressure, microscopic droplets of fluid begin to leak out of the bloodstream and slip into the surrounding tissues. This is precisely why seniors will often say, "I feel completely normal when I first wake up in the morning, but by the time I sit down for dinner, my legs feel incredibly heavy and lead-like." When you sleep horizontally overnight, gravity stops pulling that fluid down, allowing your body to naturally reabsorb it, only for the cycle to reset the moment you stand up the next day. To see how easily this manageable side effect can turn into a hidden medical emergency, we only have to look at Arthur's experience. Arthur was an active, independent 76-year-old grandfather who loved working in his backyard garden. About 6 weeks after his doctor started him on amlodipine, he noticed his ankles looked remarkably larger by the afternoon than they did when he woke up. Because he didn't want to bother his busy doctor over what he assumed was just a normal part of getting older, Arthur stayed completely silent. But as the swelling grew more pronounced, Arthur became deeply embarrassed by how his legs looked in public. He stopped wearing his walking shoes, canceled his weekly trips to the local community center, and eventually made a quiet, highly dangerous decision. He started skipping his amlodipine doses on any day he wanted to leave the house. By hiding his symptoms out of embarrassment and a desire not to be a burden, a completely manageable drug side effect transformed into an invisible threat of dangerously high, uncontrolled blood pressure. If your ankles are swelling on amlodipine, it does not automatically mean the drug is toxic or that you must stop taking it immediately. It means a conversation needs to happen with your healthcare provider. Your doctor has an array of tools to fix this, whether that involves adjusting your dosage, introducing a companion medication to balance out the vascular pressure, or switching you to a different class of medicine entirely. What you must never do is suffer in silence or take matters into your own hands by altering your doses. Your body is speaking to you through that swelling. Your job is to listen, understand the mechanism, and report the data safely. If you take Lisinopril, you are taking an ACE inhibitor, a medication that lowers blood pressure by blocking an enzyme your body uses to constrict blood vessels. While highly effective at protecting the heart and kidneys, lisinopril is famous for a side effect that drives millions of seniors to sheer frustration: a persistent, dry, hacking cough. This cough is uniquely irritating because it is entirely non-productive. There is no mucus, no congestion, and no fever. Instead, it feels like a relentless, stubborn tickle right at the back of your throat that refuses to go away. What makes it a psychological trap for older adults is its unpredictable timeline. Unlike a typical allergic reaction that happens within minutes of taking a pill, the lisinopril cough doesn't always start on day 1. It can show up within the first few days, a couple of weeks, or it can quietly emerge after several months of being on the medication without any issues. Because of this delayed onset, seniors and their families rarely connect the dots. They assume they are suffering from seasonal allergies, dust in the house, dry winter air, a lingering cold, or a sudden flare-up of acid reflux. Consider Helen, a 69-year-old grandmother who developed a nagging throat tickle 4 months after starting lisinopril. Soon, the tickle turned into exhausting nighttime coughing fits. Her sleep suffered, her daytime energy plummeted, and she assumed her body was just failing due to old age. Helen spent hundreds of dollars on throat lozenges, changed her laundry detergents, and even replaced the air filters in her home, yet nothing helped. When her pharmacist finally asked if her cough had a connection to her daily pill, Helen was stunned. She had never been told that a lisinopril cough could arrive so late. The biological reason for this cough involves a compound called bradykinin. ACE inhibitors naturally cause bradykinin to accumulate in the respiratory tract. In about 10 to 20% of patients, this accumulation hypersensitizes the airways, triggering a continuous involuntary cough reflex. While this cough is incredibly annoying, disruptive to your sleep, and detrimental to your quality of life, it is medically benign, meaning it is not actively destroying your lungs. However, because the word swelling and cough get tossed around casually in pharmacies, many patients confuse this annoying nuisance with a completely different life-threatening allergic emergency called angioedema. Angioedema is a rapid, severe swelling of the deep layers of the skin and tissues, most commonly affecting the lips, tongue, face, and throat. While a dry cough is an annoying side effect of bradykinin buildup, angioedema is a critical, unpredictable medical crisis. It can cause the tongue to swell to twice its size or tighten the tissues of the throat until the airway is completely blocked, making it impossible to breathe or swallow. This is not a wait-and-see situation. This is not a call the doctor's office on Monday morning scenario. If you take lisinopril and notice your lips feel numb, your tongue looks puffy in the mirror, or you suddenly experience difficulty swallowing or a hoarse voice, you are facing a medical emergency. You must call 911 or head to the nearest emergency department immediately. The tragedy in senior healthcare is that many patients quietly suffer through the nagging dry cough for months without saying a word, assuming they just have to live with it to keep their blood pressure down. Eventually, out of sheer exhaustion, they stop taking their medication entirely without telling their doctor, leaving their cardiovascular system exposed to dangerous spikes. If you are struggling with a persistent dry cough, remember that you do not have to be a silent martyr to a medication bottle. Your doctor has an entire class of alternative drugs, such as ARBs like Losartan, that lower blood pressure effectively without triggering that frustrating bradykinin pathway. Pay close attention to your body. If it is a nagging tickle in the throat, schedule a conversation with your care team. If it is swelling of the face, lips, or tongue, move fast and seek emergency care immediately. Comfort and safety should always go hand in hand. For seniors taking Losartan or Lisinopril, there is a quiet chemical shift that can happen inside the body without a single outward symptom. It involves potassium, a vital mineral that your body relies on to keep your muscles contracting and your nerves firing. Under normal circumstances, your kidneys act as precise filters, flushing out excess potassium through your urine to keep your internal levels perfectly balanced. However, both Losartan, an angiotensin II receptor blocker, and Lisinopril, an ACE inhibitor, alter the hormones that regulate this filtration process. They cause your kidneys to hold on to potassium while excreting sodium. When your potassium levels begin to climb above the normal threshold, a condition known as hyperkalemia develops. The true danger of hyperkalemia is how quietly it builds. It doesn't announce itself with a loud, dramatic warning sign. In its early stages, it might masquerade as simple muscle weakness, a mild cramp in your calf, a strange tingling sensation in your fingers, or just a heavy wave of afternoon fatigue, symptoms that almost every senior dismisses as a normal consequence of a busy day or a poor night's sleep. But if left unchecked, dangerously high potassium levels directly disrupt the delicate electrical rhythm of your heart, leading to life-threatening arrhythmias or a sudden cardiac event. Most seniors hear their doctor mention potassium and think, well, I don't take a prescription potassium supplement, so I am perfectly safe. But this is where the hidden trap waiting in millions of American grocery stores catches the most well-intentioned, health-conscious older adults completely off guard.
Consider Robert, an active, disciplined 74-year-old grandfather from Ohio. Robert was incredibly proud of his commitment to his health. After his doctor diagnosed him with high blood pressure and prescribed Losartan, Robert went home and immediately overhauled his kitchen. He knew that sodium was the great enemy of blood pressure, so he began reading nutrition labels with meticulous care, cutting out processed foods and entirely eliminating the salt shaker from his dinner table. Wanting to still enjoy flavor in his home-cooked meals, Robert walked down the spice aisle at his local grocery store and picked up a popular, commercially available, heart-healthy salt substitute. The front of the bottle proudly proclaimed it was entirely sodium-free and perfect for cardiovascular wellness. Robert felt like he was doing exactly what his medical team wanted. He seasoned his morning eggs, his afternoon soups, and his evening steaks with this substitute every single day. What Robert did not realize, and what the tiny print on the back of the label rarely highlights clearly enough, is that almost all sodium-free salt substitutes replace sodium chloride with potassium chloride. By using this substitute so generously, Robert was unknowingly flooding his system with massive doses of extra potassium. At the exact same time, his daily Losartan was preventing his kidneys from excreting it. Within a month, Robert began noticing subtle changes. His legs felt unusually weak when he tried to walk down his driveway to grab the morning mail, and every so often he felt a strange, fluttering skip in his chest. He brushed it off as anxiety until his routine follow-up blood work revealed that his serum potassium had spiked into a critical danger zone. Robert wasn't careless or reckless, he was trying to be highly compliant. He got hurt because nobody had connected the simple dot between his medication bottle and the spice aisle. The grocery store trap doesn't end with salt substitutes. High amounts of hidden potassium frequently show up in over-the-counter electrolyte powders designed for hydration, certain low-sodium canned soups, meal replacement shakes, and health supplements marketed for joint health or energy. This is why, if you are prescribed Losartan or Lisinopril, routine laboratory follow-up is a non-negotiable pillar of your safety plan. Checking your blood chemistry isn't just an administrative chore or medical theater. It is the only definitive window your doctor has into how your internal filtration system is handling your medication. Protecting yourself doesn't mean you need to live in constant fear of a banana or a baked potato. It simply means stepping out of the dark and into active awareness. Read the ingredient list on any seasoning blend or supplement you bring into your home. Look out for the words potassium chloride, and always ensure you are keeping up with your scheduled lab visits. Your health is a partnership between what happens in the clinic, what sits in your pill box, and what you put in your grocery cart.
When your physician prescribes an ACE inhibitor like Lisinopril or an ARB like Losartan, they are often thinking far beyond the numbers on your home blood pressure monitor. In the right patient, these medications are extraordinary tools for long-term organ preservation. They work by dilating the efferent arteriole, the tiny blood vessel that serves as the exit pipe for fluid leaving the kidney's microscopic filtering units known as glomeruli. By opening this exit pipe, the medication lowers the intense, destructive internal pressure inside the kidneys. For seniors managing early-stage chronic kidney disease or diabetes, this subtle drop in pressure is a massive victory that shields the delicate organ from scarring and long-term decline. However, this mechanical shift creates a profound clinical paradox that terrifies many older adults when they first check their digital medical charts. Because the medication deliberately lowers the internal filtration pressure, your kidneys will naturally alter their filtering speed at the start of treatment. When your doctor runs routine blood work a few weeks after you begin taking the medication, or after a dose is increased, the lab results will often show a mild immediate rise in creatinine or a slight temporary dip in your eGFR, estimated glomerular filtration rate. To a patient sitting at home looking at their online portal without context, these numbers look like terrifying proof that their new medicine is actively destroying their kidneys.
Consider Sharon, a 71-year-old retired schoolteacher. She saw her eGFR drop by a few points on her patient portal on a Friday evening. Panicked, she assumed the lisinopril was toxic and came within one click of stopping her medication cold turkey over the weekend. What Sharon didn't know was that a mild, supervised shift, typically a creatinine increase of up to 30% that eventually stabilizes, is not a sign of damage. It is a sign of the drug actively changing the kidney's internal dynamics to protect it over the next decade. This is why lab follow-up is a critical component of your safety plan. Guessing based on a single portal notification creates unnecessary panic. While a mild shift under normal conditions is expected, your kidneys can slide into sudden, acute danger if your body's fluid balance undergoes a sudden change. Dehydration changes every single rule of blood pressure management. If you experience a sudden stomach virus, vomiting, diarrhea, heavy sweating during a humid American summer, or a poor appetite where you simply forget to drink enough water, the internal environment of your body shifts dramatically. With less fluid circulating in your bloodstream, your body's natural defense mechanism is to constrict the entry pipes to the kidneys to maintain systemic blood pressure. But if you are still taking your daily Losartan or Lisinopril, the exit pipes remain artificially wide open. As a result, the kidneys are starved at adequate blood flow. The drug that was quietly protecting you on Monday can suddenly cause your blood pressure to bottom out on Wednesday, leaving you dizzy, weak, and vulnerable to acute kidney injury.
The threat multiplies exponentially when you introduce a seemingly harmless item sitting in millions of American medicine cabinets: common over-the-counter anti-inflammatory pain relievers. Millions of seniors live with chronic osteoarthritis, lower back pain, or joint stiffness. To cope with a busy weekend of gardening or playing with their grandchildren, they routinely reach for over-the-counter non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, Advil or Motrin, or naproxen, Aleve. Because these pills don't require a prescription, seniors rarely think of them as powerful chemicals that interact with their prescription regimen. If you combine an ACE inhibitor, or ARB, a diuretic, a water pill often prescribed for leg swelling, and a routine dose of NSAIDs, you create what the medical community calls the triple whammy. This combination is a perfect clinical storm for the kidneys. The NSAID blocks prostaglandins, which forcefully constrict the entry pipe bringing blood into the kidney. The diuretic reduces the overall volume of fluid and salt in the body. The ACE inhibitor, or ARB, leaves the exit pipe wide open, preventing the kidney from maintaining its internal filtration pressure. When all three factors hit a senior's body simultaneously, especially during a brief bout of dehydration, the microscopic filters of the kidneys are instantly starved of blood flow and pressure, which can trigger sudden, acute kidney failure within a matter of days.
Take Frank, an active 78-year-old who took Losartan daily. After developing a mild stomach bug that left him mildly dehydrated, he took several ibuprofen tablets to combat a worsening headache and joint aches. He proudly powered through, refusing to miss his daily medication routine. By that evening, when he stood up from his favorite armchair, the room spun violently and he collapsed onto the carpet. In the emergency department, his lab work revealed acute kidney strain. The issue wasn't that Losartan was a flawed medication. The issue was that Frank was operating in a depleted fluid environment while unknowingly triggering a toxic drug interaction. To stay safe, you must establish a clear sick day plan with your healthcare team. If you experience an illness that prevents you from keeping fluids down, or if you are managing severe seasonal joint pain, do not suffer in silence or guess your dosages. Talk to your provider about safer alternative pain relievers, such as acetaminophen, and ask exactly when to temporarily hold your blood pressure medication during an illness. Your kidneys are resilient, powerful filters, but they require consistent communication and a safe internal environment to do their job properly. When you begin taking a new blood pressure medication, like Amlodipine, Losartan, or Lisinopril, or when your physician decides to increase your current dosage, your cardiovascular system undergoes a significant period of recalibration. For months or even years, your heart has been pumping blood against tightly constricted, high-pressure arterial walls. When these medications do their job and successfully force those vessels to relax, your overall blood pressure drops. While this is exactly what we want to prevent a long-term stroke or heart attack, it often creates a temporary side effect that seniors routinely normalize until it turns into a physical catastrophe, dizziness and lightheadedness. In the medical community, this specific sensation is often tied to orthostatic hypotension, a sudden drop in blood pressure that occurs when you rapidly shift your physical position, such as moving from a lying down position to sitting up, or standing up too quickly from an armchair. When you stand up, gravity naturally pulls blood down into your lower extremities. In a youthful body, the nervous system instantly signals the blood vessels to constrict and pump that blood right back up to the brain. However, as we age, this reflex naturally slows. When you layer a powerful blood pressure medication on top of that natural delay, the brain can be temporarily starved of oxygen for a few critical seconds. Millions of independent older adults brush this off. They experience a brief wave of wooziness upon standing, grab onto a nearby wall, laugh it off, and say, "Oh, I just got up too fast." But in the context of senior health,
A few seconds of dizziness is never a casual joke. It is a direct trajectory to a fractured wrist, a severe head injury, or a broken hip that can permanently steal your physical independence. Consider Joseph, a fiercely independent 80-year-old grandfather who lived alone and prided himself on never needing help around the house. 2 days after his doctor increased his daily dose of amlodipine, Joseph woke up in the middle of the night to use the restroom. He sat up, stood out of bed, and walked briskly across the dark room. Suddenly, the world tilted violently. His vision went completely black, and he only avoided a catastrophic fall by blindly grabbing the edge of the bathroom sink just in time. Joseph had been told by his pharmacy that the medication would lower his pressure, but nobody had taken the time to prepare him for what that would actually feel like in a real, aging body moving through a dark house at 3 a.m. He hadn't been taught the critical protective habits: rising slowly, sitting on the edge of the mattress for 30 seconds to let his circulatory system stabilize, and ensuring a clear, well-lit path. This brings us to one of the most destructive habits intelligent patients fall into when managing their health at home: making impulsive, emotional dosing decisions based on a single, isolated number on a digital monitor. Blood pressure is not a fixed, rigid metric like your height. It is a highly dynamic, constantly fluctuating variable. It shifts dramatically based on your quality of sleep, a stressful headline you just read, a recent argument, a sudden bout of arthritis pain, a cup of morning coffee, or even the intense anxiety of watching the blood pressure cuff inflate on your arm, a phenomenon known as white coat syndrome. Take Diane, a 67-year-old retired bank teller who checked her blood pressure every single time she felt a wave of worry. If she had a mild headache, she checked it. If she watched a stressful news segment, she strapped on the cuff. If she saw a single high reading, her heart would race, and she would instantly check it again 2 minutes later, then again 3 minutes after that, creating a spiral of panic that forced her numbers higher and higher. Convinced her Lisinopril was completely failing, Diane was on the verge of taking an extra pill to force the number down. When you judge your health by a single startled glance at a monitor on a Tuesday morning, you are reacting to noise, not data. Good medicine combined with bad interpretation always creates dangerous outcomes. Medications like Amlodipine, Losartan, and Lisinopril are long-game interventions. They work through steady, cumulative chemical balance, not as rescue pills to treat a temporary spike. You must train yourself to look at the trend, the average of your numbers, taken at the same times each day under calm, restful conditions, rather than reacting with panic to a single high or low snapshot. Ultimately, your side effects are not a sign of personal weakness, nor are they a nuisance you must silently endure just to keep your medical chart looking pristine. Swelling, a dry cough, unexpected weakness, and persistent dizziness are all vital pieces of clinical data. Being a good patient does not mean sitting in silence, hiding your discomfort, and blindly swallowing a pill that ruins your quality of life until you eventually give up and stop taking it in secret. True safety lies in active, educated partnership with your healthcare provider. Your job is to observe your body's patterns with clear eyes, track your daily trends without obsession, and report that data to your clinical team early. When you step out of the fog of half-knowledge and understand exactly how your medication behaves, you stop being a passive bystander in your own care. You become an empowered advocate for your own longevity, ensuring that your treatment plan protects your numbers on paper while fiercely safeguarding your safety, your comfort, and your independence in the real world.